Hello, I'm Dr. Gil Wilshire at Missouri Fertility in Columbia, Missouri. I understand you're considering getting your tubal sterilization reversed. Well, this surgery is something that not many people have experience in anymore. Here at Missouri Fertility, we have over 30 years experience doing this surgery. We are very good at it. We use the best techniques, the most high-powered microscopes, and our success rates are very, very good. Now, the reason our success rates are so good is we do this procedure in people who are good candidates for the surgery. So how do we determine if you're a good candidate for the surgery? The first thing we need to know is what type of sterilization did they do to your tubes? Now, fallopian tubes are generally about 10 centimeters long, and if a clip, a fill sheet clip or a fallope ring has been put on your tube, you lose very little tube in the process, and when we put the tube back together, it still has a really good length. Your op note will also tell us if you had something more popular called a Pomeroy or a Parkland. That's where they take out a little more tube, but when we put those tubes back together, hopefully we can get a tube that's at least 6 centimeters long, and those are usually pretty functional. If your op note shows that you had a burning or a fulguration procedure, or God forbid they took out the ends of your tubes, those are generally not repairable. So your op note is something really important in your history. We will want that. Now, if they took out a lot of tube, we might end up with a super short tube that I call a T-Rex tube. Remember the T-Rex dinosaur, those tiny little arms? That's no good for what we want to do. We need nice long tubes. If we end up with stubby little tubes, they generally will not work, and we should avoid the time and the effort, the risk, the expense of putting tubes back together if they're going to end up being really short. A second thing we're going to need from you is an analysis of your male partner. Does your male partner have an adequate semen analysis so that intercourse has a good chance of pregnancy after we go through all this effort to put your tubes back together? So almost every male partner is going to need a semen analysis. There are some exceptions, but generally we will want to do that. Third, you need to be of reasonable weight. You can be a little bit overweight, but if your abdomen is very thick or you're extremely overweight, this procedure is probably not a good idea for you. It means we need to make a bigger incision. The chance of having infectious problems or wound problems is higher, and it's harder for us to actually do the procedure. So if you're overweight and you want to have this procedure done, cut the carbs today. Start weight loss immediately so we can get you down to a more reasonable weight to go ahead and do this procedure. We want it to work. A final point of courtesy: if you can't make your appointment, please call us ahead of time. Give us a few days notice. People wait weeks to see us. We're very, very busy, and if we lose that time slot, it doesn't do anybody any good. So please give us some notice if you can't make the appointment. We would love to see you. We would love to help you, and we'd like to work forward together in a cooperative way to make this successful. So there you go. There's an overview of reversing tubal sterilization. This is Dr. Gil Wilshire at Missouri Fertility, Columbia, Missouri.